Well, our state will go into phase 1 of reopening a week from today, as we said. And joining us to talk about their role in this is Jeffrey Flaks, President and CEO of Hartford HealthCare. Thank you for being with us.
Thank you. Hi, Lisa.
Hi. So as the state prepares to reopen and get back to normal, you have a different approach. Tell us about that.
Well, I often describe, with respect to healthcare, we want to be better than normal. So I'm really excited, Lisa. There's been great advances during this crisis, important things we're doing, and we're going to ultimately see the use of digital health, telehealth visits, the work we're doing to connect to our patients by having 24-hour hotlines in place to have better access, the work we're doing around testing, and the way we're doing a much more effective job of providing access to care in our communities of people who are most vulnerable. These are all things that need to take hold, and we need to be better going forward. We need to learn from it.
It really sped up the whole process. All right, let's talk about how the virus has changed the way people view the healthcare system.
So there's a lot of trepidation, nationally that's being discussed around people's comfort and their willingness to re-engage with their physicians, to get testing, preventive health measures in place. And we're doing everything we can within our system, really innovative things to give people assurances. So anyone who's coming for procedures, having surgeries, we're providing testing to them. We're providing significant testing to our staff. We have screening before anyone enters any one of our facilities with both temperature taking and a series of questions. And we've put new measures in place. For instance, we're using texting services. So we're closing our exam rooms in many instances and bringing people in from their cars. And we've built plexiglass in different locations to stop exposure between our staff and our patients we're serving. So many different advances, many ways to provide support to the people we're caring for. But most importantly, so the message is that we're up, we're running, and we need to be here to take care of people. These are vital services we provide in our community. They need to be done safely, but we also need to be accessible.
So many safety measures in place now. People should know that. So Hartford HealthCare has been a resource when it comes to testing here in the state, launching more sites, including mobile testing. How critical do you see testing as we move into the next phase in containing this virus?
Oh, it's essential. I'm really proud at Hartford HealthCare. We have a network now. We've built 10 testing centers that go across the state of Connecticut, and we operate a mobile testing site. We've been testing nursing homes. We've been testing homeless shelters. We're testing community health centers. So we're able to use our pop-up center and go to areas where we need testing for very specific populations in any given community. And the 10 centers we've created across Connecticut have dramatically expanded access. So when we think about how to stand up Connecticut, return ourselves back to business, testing is a vital piece of this, and we're going to be certain that we have ample testing in our state as time goes forward.
All right, let's talk about the agreement reached last week with a large corporation by providing dedicated physician services. Tell us all about that.
It's exciting. So we are now working in several instances where we are taking physicians within our health system and assigning them to corporations, and they're joining the executive leadership teams of these different corporations as chief medical officers. And what they're doing is they're helping that team make decisions about how they're going to return people to work, how they're going to redesign their offices, what policies they're putting in place around screening and testing, how they can monitor the health and well-being of their workforce. So I'm just thrilled that we could take our physicians and redeploy them in places that help the state, help the economy, and help bring our state back to work in ways that make most sense. So it's a really wonderful advancement.
Great to hear. All right, let's talk about your 8 weeks in. How has the staff been? It's been such a long emotional stretch.
I'll tell you, Lisa, it's unbelievable. The resilience of our staff. I'm in awe. I continuously say that. I keep visiting different parts of Hartford HealthCare, and when I round and I talk with different people, the vast majority of people have stood so strong, so tall. They're here for our community. They're doing whatever is necessary to be here when we need them most, and they're being resilient. So it's really difficult. We've been under great distress at different times to this crisis. It's by no means over. We're now in a new normal where we're taking care of COVID-positive patients and at the same time reopening services that were shut down. And my gratitude to all clinicians, all members of our support services teams who are rising to this occasion right now. It's hard for me to even describe it. It's just absolutely exceptional.
Oh, and just so much gratitude for everything they're doing. All right, Jeffrey Flaks, thank you so much for taking the time to bring us up to date once again today. We appreciate it.
Thank you, Lisa.